Welcome to Your Health Matters. I'm your host, Temesia Tuicaumia, and today we have two very special friends that I actually know very personally that are here to talk about something really important about the month of September. Now, I'm going to stop talking so they can introduce themselves. So I'm going to go ahead and start with you. How are you today?
Very fine. Is it Friday yet?
Yes.
Thank you so much for having us today.
Thank
My
you for
name
being
is
here.
Ray. I'm currently a medical officer. I'm serving our pediatric oncology unit
Yeah.
at C.W.M hospital. So we basically look after children who are suffering from cancers.
Wow.
Yeah.
Thank you so much. How long have you been doing this actually?
So with the pediatric department, this is my third year.
Wow.
With the oncology unit, this is my first year.
Wow. So you see a lot of children come in and out.
Yes.
Wow. I'm going to go ahead and have you introduce yourself.
Temesia,
Naka.
Bula, everybody. My name is Mere Lutuciri Williams, and I'm with WOWS Kids Fiji. So WOWS Kids, WOWS stands for Walk On, Walk Strong. We are an NGO, the organization, the only one in Fiji that looks after children with cancer. So we support all the children that are diagnosed with cancer that come through Dr. Ray's team at C.W.M or Aspen Lotoka. WOWS Kids look after them. And
How long have you been with WASKIS now? Because
Yeah.
I've seen you like
I
every
know.
other space, yeah.
At our events,
Yeah.
more than 5 years now.
Wow.
Yep.
That's amazing. And of course, you see children in and out.
Yes.
And you're not just covering Suva, you're covering the whole
Entire
of Fiji,
Fiji,
entire
that's
Fiji.
right.
Wow. Well, I'm going to go ahead and start with you. I think everybody here in Fiji knows, oh, cancer, cancer, but I don't think they really understand what, childhood cancer really is. Do you mind just explaining that for us?
Sure, no problem. So when we hear the word cancer, many of us tend to think that it only affects adults.
Right.
There are generally like a lot of forms of adult cancers that we can think of, including breast, ovarian,
prostate
yeah, that's
cancer.
correct. But cancer also affects children.
Right.
Cancer in general, so our body is made up of cells, and these cells, they tend to grow and divide and die, and this process occurs very often. But for cancer, this process is disrupted.
Okay.
So they just tend to grow and divide when they're not supposed to. And then these extra cells, they tend to form tumors,
Right.
which becomes a cancer. Yeah. So in Fiji, we see about 20 to 30 cases,
Wow.
new cases of childhood cancer every year. We have 8 active cases with us in C.W.M who are undergoing chemotherapy, 2 in Lotoka Aspen and 1 in Lambasa. But the common form of cancers that we see in children include leukemia, so cancer of the blood,
Yes.
lymphomas, brain tumors, cancer of the bone, such as osteosarcomas,
Yes.
and cancer of the kidney, called Wilms tumor. So these are some of the common
Common
cancers
ones
that
that are
we
going
see in
around.
children in Fiji.
Did you say there's like 20 to 30 children?
Yes. So every year we
Wow.
see an average about 20 to 30 new cases.
And sorry, Dr. Jone, how young are these children that are coming in?
So our pediatric department, we see children, anyone that's under the age of 15.
Under the
Yes,
age of 15.
15.
Okay, I had another question. You know how they have stages, cancer? What stages are these parents like, oh no, my child is cancer, and they're bringing them in? What stage are they at? Is it early or?
So there's different stages of cancer, which is why we have come today to try and advocate and create awareness on some of the early warning signs
Okay.
that parents or guardians can see in their children,
Yeah.
and straight away bring their children to the health center or the hospital.
Wow. I think that's something they like to say a lot, right?
Yes.
Early detection, early detection.
Definitely. Yeah, so some of the early warning signs that parents can see. So generally the symptoms of childhood cancers are non-specific,
Okay.
meaning
Yeah.
they can be symptoms of other illnesses, not just cancer. Yeah. So once they present to the health center, the medical officer or the nurse practitioner or the doctor seeing their children might not think of cancer as the first diagnosis. We'll treat an infection, send home on antibiotics and other medications, and that is why we also request for parents and guardians to go to the same doctor if the initial medications don't work.
Okay.
So that same doctor can now think, okay,
Wow.
we should try and rule out cancer as well and refer your child to the oncology.
Ray, when you say like symptoms, because I can already hear like, you know, how our families are. You know, when the child complains, say, man, I can't breathe properly, or like, something's wrong, and then, you know, our families, oh, that's just because you've been playing too much. Like, you know, just sit down.
True.
Like, you know, those kind of things. Like, what are some symptoms? Is it like their eyes, or the way they're breathing, or their sleeping patterns? What really is something that you can like, oh, I need to take my child in, they need to be checked, something's definitely wrong?
So some of the common early warning symptoms that parents or guardians can see in their children include persistent weight loss.
Oh.
If your child's weight is
That's a
just
good one, yeah.
dropping and dropping. One way to quantify this is if the regular clothes that your children wear are getting loose. That is
that's
one
a
way
good
to
one.
quantify weight loss. Persistent fever, even with antibiotics or paracetamol.
And it's just
Fever is
continuous.
still there, yes. That's also
Wow.
another warning sign. If there's any abnormal lumps or bumps, particularly in the neck or in the abdomen.
I can, you know, when you're little, and your cousin has something, you're like, oh yeah, I can feel it. And then they do nothing about it, you know. That's the moment, you know, go and
Exactly,
check it. I
yes.
mean, there's no harm, right? Going to
Yeah.
the hospital and
There's
getting
no harm,
checked.
yes. And also persistent headaches that's accompanied by vomiting. This usually happens in the early morning.
Yeah.
And also once your child has a cut,
Yes.
and then it just keeps on bleeding and bleeding. So there's only a certain time we expect the bleeding to stop.
Right.
But then if it keeps on bleeding, that is also an early warning sign.
Need to come in for a checkup. I was just talking to someone who's a dancer, and I didn't see him post any much of his dancing, and I was like, hey, is everything okay? Oh no, he posted something about him being sick, and I said, what happened? He said, oh, my leg is swollen, and I was like, right away I knew there's like fluid or whatnot.
Exactly.
Yeah, but he said, no, I'll be okay, I'll just rest it. I said, no, that's not how it works.
Yes.
Get your friends, go to the hospital right away,
Exactly.
because it can get worse, right? I mean,
Definitely.
you're dealing with the bone, you're dealing with, you know, other parts of the body, because it'll
Needs to
affect,
be
like the
investigated.
tumor, right? It
Yes.
doesn't just, it will continue to affect the whole
Yes.
body, right?
So it can spread.
It will.
Can spread
Yeah.
to other parts of the body, and that's when we know it's too late.
Wow.
Yeah.
Well, thank you so much, Dr. Jone.
Thank you.
My friend Ray. Yeah, that's a lot to take in. So we'll be right back after the break with Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Welcome back to Your Health Matters. I'm your host, Temesia Tuicaumia, and I have two of my really good friends, Dr. Jone, that I love to call Ray, and Mary, who works for WOW's Kids. Now, she doesn't just work there, she's passionate about this, and she's brought me some presents, so have a look.
Well, you know, September is International Childhood
It
Cancer
is,
Month.
it is.
Temesia, that's our
Did
wristband.
I see some rugby players wearing this as well?
Yes,
Yeah,
they
yeah.
made it.
I love it. Oh, and is gold the color for...
Gold ribbon, yes.
Gold ribbon.
That symbolizes childhood cancer.
So the month of September is specifically for children with cancer? Is
Childhood
it
cancer.
Childhood cancer, sorry.
Yeah.
Not children with cancer, but childhood cancer. Man, I'm just going to put it right here. I'll put it on later. You know, the next question really is, a lot of these families, like you said, Dr. Jone, I can imagine what's going through their head. Like, how am I going to pay for this? I don't even speak good English. I don't even know where to go. It's a lot. And I guess that's where WOW's Kids comes in and is like a safety blanket for these families. Because I've heard some really cool stories of how WOW's Kids steps in for a lot of these young children. Even Kimberly and I were talking about we should get them some school books because they can't go to school for a period of time and all of that. So what's it like working in your space with WOW's Kids and supporting the Ministry of Health with our government of Fiji?
Yeah, maybe I should start off with that because we work in close collaboration
Very
with
close.
the Ministry of Health. And at the same time, we do acknowledge that services, facilities, and resources are limited.
Very limited in our country,
and especially around pediatric oncology.
Okay.
Yeah.
Okay.
So I'll specifically for in particular around that in that
this
space.
Is a great time to put it out there to anybody that would like to support.
Yeah.
They really need resources here in our beautiful country.
Yeah.
Please reach out to WOW's Kids. Sorry, Mary, go ahead.
We do have families like the Smart family, Kimberly's
Yes.
family, that have been supporting WOW's for many years now.
Yes.
And so with WOW's Kids, we don't only help our children and their families with cancer, but also our doctors and nurses that work in the pediatric oncology unit at C.W.M and Aspen Medical in Lutuciri. Yeah, so these are the two hospitals that have the pediatric oncology unit that we support as well. So in terms of families, yes, we come in as soon as the doctors confirm the diagnosis that a child has cancer, they refer them to WOW's Kids.
Really?
Yeah.
So I was wondering how that relationship happens.
So,
okay.
So that's
Sorry, Mary, just a question. Do some families come directly to you?
No.
Oh, no.
So all of the children, we're looking at almost 60 children right now. I think Dr. Ray can elaborate on the active and the palliative cases.
Yes.
But they all come through the pediatric oncology.
Okay.
So we don't do community screening like they do with adult cancer.
Yes.
They go out and you can do breast cancer check out in the community, not with childhood cancer. So we wait on the advice of the pediatric oncology units, then we take over. So we
So
are
you
there.
probably see each other more often, right?
Yes.
Like every other day?
Yes, we do. Yeah, so we actually have, now we have a parents' room at CWM.
Oh,
They've given us a ward,
congratulations. That's awesome.
right next to the pediatric oncology wards. So, that's how the ministry values our work.
Yes.
And we really do appreciate that. And so we are more present now right there.
Right there.
In interacting
Not a phone
with
call
the
away,
fam-
but just a door away
Right,
from the
that's right,
patient.
yeah.
Mary, when these children get brought to you, what are some frequently asked questions that these parents have that you just like to share? Because I know a lot of parents would be wondering everyone's watched a TV show where they say, oh, if you want to go for surgery for cancer, it's millions of dollars or thousands of dollars.
Right.
And it's overwhelming.
Yes.
Or they're like, oh, I don't speak good English, or I'm not well educated enough to understand what the doctor is saying. How do you support that, Mary, your team?
WOW's Kids provide the support like transportation. That's like the highest cost
all
component
the way to
of our
transporting
operation,
the families.
From home, wherever they live around Fiji, to the hospitals for their treatment or review, and back home. Medication that's not available in these two main hospitals, we cover for that as well. And the social and psychological support like counseling that we assist with. We set up peer groups for the patients and the parents as well. And so we basically, our existence is to help ease that financial burden on parents. And the journey that they're going through is not easy. Some cancer journeys are longer than others. Dr. Ray can elaborate on that too, because we have a child who's returning from the islands right now, Lau, Totoya, in the cost of traveling. So we're covering that. We pay for the boat trips to the islands and return. And now he'll be on his monthly treatment. So we'll be doing that. We'll be covering that monthly cost for the parents. While they're here, we're visiting on a weekly basis as well. Taking care of little things like that. So the parents will now just focus on treatment and recovery and not worry about these major costs that's associated with transportation and medication.
A lot of parents must be going, please, sorry, Dr. Jone, if you have anything to add,
Yeah.
please feel free. A lot of parents, again, you know, I love how you mentioned the counseling. How does it really benefit these families that they have a place to talk, knowing our, you know, we
Yes,
love Fiji, but our culture very
settled,
strong, you know, there's certain things you talk about, certain things you don't. And I don't know what it's like in the terms of childhood cancer, but is there shame brought on the mother? The dads don't feel like they can support the family much. So, you know, there's so much that goes on during that period of time. What are the normal...
That's the stigma.
The stigma, that's the word.
Childhood cancer. That's where we come in.
Good.
And we work with doctors and nurses and just, you know, reaching out to the communities and just making people understand that cancer is not contagious, you know, and it's not because of a curse or something the parents have done wrong.
I've heard that before.
Those are some of the stories that we've received back from the parents that we're looking after right now. So it's breaking down those misconceptions, and the media becomes a key player in this because you definitely can help
to
us
all our
to
media partners out there, please, you know, take this time, if you could work with WOW's Kids to collaborate on advocating, because Mary's going to show us a really cool poster right after this.
So with you know, some families, they're not comfortable even talking to their own relatives about the issues, the matters. So we at Pediatric Oncology and WOW's, we refer to our counseling sessions as Talanoa sessions.
I was playing rugby, or your daughter running around outside to falling, going to the hospital, finding out they have cancer. Your world just turns upside down in a day or less than an hour. That's heavy. That's heavy.
And with the cancer, it's not just the child that's affected, it's the family unit.
The whole family unit.
Yeah, so that's why with our support,
it goes back to that quote where it says it takes a village to raise a child. It's going to take a village too to look after that child in that time.
That's right.
That's so good. Well, we've been chatting quite a lot, so we need to go to another break. I hope you've been enjoying our conversation today with Dr. Jone and Mary from WOW's Kids. If you have any questions, please make sure to check out WOW's Kids on Facebook and on their website, and also just searching them up, and also coming and seeing our team at C.W.M. We'll be right back after this break.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.
Well, the conversations have been really good tonight with our two guests, Dr. Jone and Mary from WOW's Kids. They have a really cool poster here that I'd really love them to share with us. And I think it goes back to what you said, Mary, about advocacy and getting the media involved, right? It's so key. So do you mind just sharing with us the poster we have here?
Sure. So basically, Temesia, this poster...
let me hold that for you.
It's a more simplified way.
Oh, nice.
In
Yeah,
which
everything
WOWs have come up with to help parents and guardians to see if any of these early warning signs or symptoms, if it is present in your child or your children, for them to present to their nearest health facility as soon as possible. And it's basically what I've mentioned before. Persistent weight loss, headaches with vomiting, any abnormal lumps or bumps, bleeding, abnormal bleeding when they're lethargic, they're nauseated or vomiting, constant headaches, easy bruising.
This is so easy and simple to follow.
This is a more simplified way.
Yes, this is very good.
Yes. And it's all over the internet. It's on the WOW's Facebook page.
On WOW's Kids Facebook page.
Yeah. And,
and so, Dr. Jone, we were just talking about if a parent is out there right now, say in Vanuatu or out in Lao or as far as the Yasawas, they don't need to come to Suva for this, right? They can go...
No, they don't. So, some of the patients or children that we receive, by the time they present to us, the cancer has advanced.
Okay.
And that is when it's too late and we are not able to offer any or much treatment.
Okay.
Which is why we advocate on these early warning signs. I guess in our Itauke culture, many of us think that it's probably a curse or
Right.
witchcraft. Sometimes the parents, they blame themselves. But please know that there's help available. So
That's
if you
good.
see any of these early warning signs and symptoms, you present yourself to the nearest health facility, whether it's a nursing station or a health center or a subdivisional
And
hospital.
these nurses and doctors are trained for this,
Yes.
right?
And
They will
everyone
know.
is much aware of the early warning signs and symptoms.
And then from there, do they get referred to you?
Yes, from
Okay.
there then they will refer to either 3 of the tertiary hospitals,
Oh, okay.
including C.W.M, that serves the Central and Eastern Division, Lotoka S.P.M that serves the Western Division, and Lambasa Hospital that serves the Northern Division.
Oh, those are the three
Yes.
main ones, eh?
And from then we'll work up your child and do further investigations and tests to see whether it is truly cancer or not.
Okay, that's awesome. And then our friends at WOW's Kids come in to have that safety blanket for mom and dad, for the children and for the extended family. Yeah, it's a lot. It's a lot. But I really love the story too of WOW's Kids. I don't know if the rest of Fiji knows, but it's got a special story. Yeah, the founders and how WOW's Kids came to be. So it makes me emotional just remembering that young girl. And I've come to know her sisters, who are very strong advocates out there. So you must go through a lot too, working for WOW's Kids. What is a message you just like to share to the moms, the dads, and maybe the carers? Sometimes Bumbu steps in, or Aji and Aja, or just
Fiji,
everyone. Yeah, we're Fiji.
I always say
Yeah.
we go advocate to the high school, especially. We talk
Yes.
to teenagers, because in our culture, in our setting, we do the me, we look
That's
after our
it.
little siblings. So
Yeah.
just being aware of
No
all
matter
this,
how old you are,
yeah.
whoever's younger, that's your
right,
responsibility.
Yeah. So it's good that we are just, we are aware of these early signs and symptoms, like Dr. Ray said, and be mindful. And it's the community. The community plays an important role in
It
this
does.
as well, because we're reaching out to the communities. There may be some families that could be going through some of these things. I think you mentioned about the shame and blame game.
That's a good way to put shame and blame. Yeah.
And that's basically the work that we do in terms of advocacy. We want to change the mindset of the community, to shift from that shame and blame to support.
Yes.
We want a
I feel like we
community
just need
that's,
to put it out there. Like,
yeah.
it's not your fault
Yes,
that your
that's
child
right.
has cancer. It's
Yes.
not your fault.
Yes.
Like, you didn't see it coming. It's not something you can foretell.
Yeah,
Uh,
don't be
but
afraid. Just seek
do not be
medical
afraid.
advice. And,
Yes.
and WOWS is there to support.
Yes.
We support families all the way through.
Was it even like was it goodie bags or food or care packs? Was it?
We do food and care
I
bags
remember
for,
that.
as
Yes.
support for our children
Yes,
as
I'll
well.
never forget. Even the WOW's walkathon or
Yes,
something.
Yes.
Yes. Oh,
Yeah.
last month was it?
Yeah, so we have a few events, like we have International Childhood Cancer Day,
Okay.
and that's in February. National Childhood Cancer Month is in August,
Okay.
because that's when Teikami
Yes.
passed away that month. So
Okay.
so that's a national.
Sorry, can
childhood
you just
cancer.
remind me her name again?
Teikami.
Tai
Yeah.
Kami.
Yeah.
Yeah,
Tai. So
Tai
Tai
Kami.
is the inspiration
Tai is
behind
the
WOW's
inspiration,
Kids,
she is.
Fiji.
Yes.
Yeah. And so and then International Childhood Cancer Month in
So
September.
the month of
Yeah.
September, to all the families out there, to all the young men that are having a little cover bowl, talk about it. Ask your brothers, ask your friends, how's their children doing, what's going on. I think it's just lovely that you've come at this particular time to just talk about it every day in
Yeah.
September.
Yeah. That's right, and that's a good point, Temesia, because we need to make, normalize.
We need to.
Yeah,
We need
in
to.
our conversation, normalize the discussion about childhood cancer.
Yes.
It's real.
It's real.
Yeah.
And families are being affected.
Yes.
Yeah. Just before we wrap things up, Dr. Jone, is there anything that you'd just really like to get off your chest to to the people out in our community? Because I know you see people come in and out every day, and you're just like, oh, I wish they only knew about this. Is there anything?
Sure.
Please, you can look right there.
I think about a month ago, I was attending a wedding.
Yes.
And the pastor had told the newly married couple, I would like to share with you guys one equation that we all know, that 1 + 1 = 2. But I would like to change it and say that 1 + 1 = 1. And I think bringing that, that thought process into this table, childhood cancer does not only affect children. It is not about you. It is not about me. It is not about they. It's not about them. But it is about us.
Wow.
Us as a family unit, at a community or society level, and also at the government level. So I think everyone needs to start talking about it.
They do. They do.
And work towards recognizing the early signs and symptoms and helping those that are suffering from cancer. Yeah.
Thank you so much for that, Ray.
Thank you.
I'll just give it over to you if there's anything that you'd just like to get off your chest as well. This is a great time to... Oh, and also for support.
Yeah. So yes, you can get involved. You can, reach out to us. We are out on Rewa Street in Samambula. Reach out to us, find out how you can help. Donations, donations in cash and in kind. You can do it on a one-off basis, or you can make arrangements for a regular arrangement.
Good.
We have lots of WOW's angels, we call them,
Oh, I love
around
that.
Fiji
Yeah.
and around the world that continue to assist
Support,
in that
and
way.
assist.
Yeah? And we have fundraising as well, Temesia.
Okay.
There's
I know you have a ball.
the ball, yeah, we've went.
There was a ball, yeah.
There was a ball.
There was a walkathon.
Yeah, so the walkathon, we have a Great WOW's Walk Challenge, we
Okay.
call that. So it opens throughout the year, and you can do it anytime
Be a part
between
of
now and
that.
December. Shave or save if you are brave enough. You can shave your head for
Wow.
WOW's Kids Fiji, for childhood cancer, and gift your birthday. So there's this concept that we are trying to push out to the community. You can gift your age in dollars. So if you're
Wow.
21, like you
Yeah.
are, and you can give $21,
$21.
and next year 22, and so
Yeah.
on. So just some things, those are some fundraising activities that you can get involved in and be part of this, great and worthy cause. Childhood cancer, supporting so many families. We always say every dollar counts, and every gift, as a donation to WOW's Kids Fiji, you are making a difference in the, the quality of life of these children and their families. So it's not just the children you're helping out, you are impacting the lives of families as well.
Yeah. Is there anything you wanted to share about the families with children with childhood cancer?
Yeah,
Just a message to moms and dads and family
Right.
around that shame and blame. I
Yeah.
think it's
Oh,
really
yeah.
key.
Okay. So maybe to the families, especially parents, parents and child caregivers. We have lots of grandparents, grandmothers that come into hospital and stay with children
With their
for
grandchildren.
weeks on end.
Months.
Mothers, for
Wow.
months, that's right. Our little boy Simone coming all the way, returning from Totoy right now, spent Christmas and New Year's at C.W.M. So, that's a common story with our children and families. If you know that any of these signs and symptoms may be happening to you, to the families, to the child caregivers, don't be afraid. Seek
Yes.
medical advice, and WOW's is always there to help, ease the burden throughout the entire journey, cancer journey for the families.
Thank you so much. Thank you both for making time and being here tonight. It's really been cool talking to both of you.
Oh, thank you.
And
Likewise.
thank you for the work you do, because on behalf of Fiji, thank you. It's not easy. So I know you have your moments too. You're like, oh my goodness, all these children, what do I do? And then you're like, we need more support, we need more money for these families. So thank you so much. You're such a blessing to our country.
Thank you.
Well, that's it for us on Your Health Matters with Dr. Jone from the Ministry of Health and a representative from WOW's Kids, Mary, who share their heart for children with cancer. Now remember, this is the month of September, and it's all about childhood cancer. talk about it when you're washing dishes, when you're having a shower, when you're in the car, when you're at the supermarket. You could change someone's life. We'll see you next week, same time, same place, here on MaiTV on Your Health Matters.
This program is brought to you by the Ministry of Health and Medical Services, shaping Fiji's health.